Good evening, everyone. Welcome to Module 2, Week 8 assessment, designed specifically for LAMP CAA students. Okay, so we are still on diagnostics. Without much ado, let's start the ball rolling. Let's call on the earliest bird who arrived, Ma'am Angel. Good evening, Ma'am Angel. Can you give us
Good evening, classmates.
answer to the first question? You don't have to read all the options, but you have to read the question. Sige po.
Number 1, Linda, a 48-year-old female, has a complaint of palpitation and insomnia for about a month. She also feels dizzy and nauseated. She has a bitter taste in her mouth and like drinking cold water. Her menstrual cycle has been irregular for 1 year. Her tongue has a yellow greasy coating. The pulse is wiry and slippery. What is the correct diagnosis for her? My answer po, Doc, is letter A po, Doc. Lack of coordination between gallbladder and stomach with stirring up of phlegm.
Okay, what are the key points in the problem? So, di ba sinabi ko before, you have to take a look at the tongue and the pulse, no? So, ano pong nakita natin sa tongue, Ma'am Angel?
Sa tongue po, Doc, meron po siyang yellow greasy coating. Apo. So, hit po siya. Phlegm hit kasi yellow greasy coating. Tapos yung pulse po niya is wiry and slippery po. So, more on gallbladder po.
Yes. And another very important feature dito is the likes drinking cold water. No? But do not forget the history. Yung complaint niya po is already meron siyang ito. Menstrual cycle has been irregular for 1 year. So when you think of the menstrual issue, anong organ will you have in mind?
Liver.
Very good. So doon pa lang, hahanapin mo na ano yung may liver dito. So we're going to rule out already letter B and letter D kasi walang liver. So we are now torn between A and C. Diba? Okay. So, paano mo in-eliminate, Ma'am Angel?
Si po kasi, yung ano niya, yung kung merong spleen-chi deficiency, so hindi po siya pasok sa tongue diagnosis na ano na her tongue has a yellow greasy
Okay.
coating. Yes po, Doc. So, eliminate ko na po si C.
Yes, very good. So the answer is A.
Yes po, Doc.
So this is basically masyadong grabe yung fire, no? Kasi as you can see, meron po siyang bitter taste sa mouth and likes drinking cold water. So ito pa lang yung nag-stir up na yung phlegm heat. Lack of coordination between the gallbladder and the stomach. So yon. Very good. Can we call, maraming salamat, Ma'am Angel. Let's go to number 2. Let's call on Ma'am Ami. Good evening, Ma'am Ami. Can you read the question first? Ma'am Ami, yung nakamute yata yung... Nakamute kayo.
Sorry, sorry, Doc.
Okay lang.
Good evening po. Good evening to everyone. A 32 years old female suffers from persistent severe headache with repeated attacks in a fixed location. Her symptoms are caused by which of the following? A blood stagnation, B, with cold attack, C, stagnation, and D, yin deficiency.
What is your answer po?
My answer is blood stagnation.
Okay. What made you give that answer? Ano po sa problem will tell you that it should be blood stagnation? Is it
Meron po siyang severe headache.
okay?
Tapos,
Pero yung pinaka-key po dito na talagang, you know, isang tingin mo pa lang, alam mo na yun eh.
yung attack niya po is naka-fixed location po.
Fixed location.
Yes po.
Nakapirmi lang sa isang lugar. That's
Nakapirma lang
very, very
po.
blood stagnation. No? Pag
Yes po.
G-stagnation po, ano yan? Palipat-lipat. Migratory pa.
Palipat-lipat.
Oo. So, pag
Tapos,
hindi
po.
mo na-address si G-stagnation, this will definitely lead to blood stagnation. Okay? What about wind attack? Ano po yung magiging presenting symptom pag may wind cold attack?
Meron po siyang without sweating po siya. Tapos cold limbs po siya. And then pag sinabing may wind attack, may cup po siya. Yung nahirapan po siya huminga pag wind cold attack po.
Okay. Ano ba yung pinaka-classic sign ng sinasabi nating wind invasion? Na alam mo ka, this is wind cold invasion, wind cold attack. Ibig sabihin ng galing po sa labas na malamig. No?
Malamig.
So, ngayon, hindi ito yung sagot natin. Pero ang tanong ko kasi, ano yung magiging problem ng pasyente? Okay. Wind cold, syempre malamig yung pakiramdam. But there should also be chills. There should be both fever and chills. Remember? And at the same time, since wind po yan, saan po pumapasok si wind? Dito po. Meron tayong, meron tayong, ano to? Occipital pain. Stiffness. No, masakit yung batok. Oo. Okay, and then meron kang feeling of cold na hindi nawawala. Hindi ka talaga ma-relieve.
Pale po yung face niya.
Okay.
Tapos, not curse po.
Okay. Pag yield deficiency po, like ano po yung magiging symptom ng pasyente? Yin deficiency.
Ang yin deficiency po is in with regards to coating po. No coating.
No, symptom.
And
Symptom.
then,
Yung nararamdaman ng patient.
ano po siya, pale po siya. Tiredness.
Ano ba ibig sabihin ng kulang sa yin? Lumalala
Tapos,
yung problem niya pag gabi? Di ba usually pag yin deficiency,
mainit po. Meron po siyang night sweat.
Okay, yon. Ano pa?
Yung dumi niya po is dry stool. Nagkakaroon po siya ng dry stool.
Dry stool ka agad?
Dahil
hindi naman siguro mabilis. Hindi ka agad, wala pa, yin deficiency pa po ito.
May night sweating po siya. Then yung throat niya po.
Have you heard of the 5-pound heat? Yung
cold po yung kanyang mga kamay at paa.
Ano po naging cold? Mukhang hindi yata tama.
May sorry, heat po yung kanya. Nag-iinit po ang kanyang mga 5 pounds.
Okay, what are the 5 pounds?
Ito pong kamay natin, and then yung paa po.
Yung
and then yung gitna po ng ating soul.
In the center of the chest. Okay.
Yung gitna po ng ating kamay.
What about thirst?
Ano po siya? Thirst po siya. Nauuhaw po siya, pero ano po siya? May desire po siya sa nauuhaw.
Okay, going back to yin deficiency, if the patient feels thirsty, Ano ba iniinom niya? Would she drink in gulps or would she drink in sips?
Insip po, insip.
Okay.
We decide to sip.
So your answer is blood stagnation.
Yes po.
Okay, thank you very much. Before we continue, we would like to acknowledge the presence of, I hope he doesn't mind. Let's welcome to our family, Fred Wolfson. Hello, good evening, Fred. Thank you for joining. For the information of everyone, Fred Wolfson is an acupuncturist from Maryland. He's been practicing acupuncture for the past 20 years, and he's into community acupuncture practice. And the good thing is, we're very excited to tell all of you is, he has decided to stay in the Philippines for good. Yeah, because after, okay, let me do some Marites first, Sir Fred.
Wow.
After being divorced for 11 years, he decided he finally found someone in the Visayas area. I think they've been on for 8 weeks. And now he fell in love with the Philippines. Would you allow me to tell them where you are, Sir Fred? And before you say anything, Fred is practicing veterinary acupuncture. Aside from,
That is really cool.
it is.
I was actually going to ask about that.
Very cool.
Hello, Fred. Can you show your face?
Hey, is my video on? I'm having a little technical difficulty here.
Okay. So many would like to make friends with you already. This is the Lam family. Welcome to Lam family. I was talking to Dr. Webb already this morning, and I think he can facilitate your what's this? Your certification.
Oh,
In
that's
Maryland, in the States, acupuncture, you need 3,000 plus hours. No? So since he is I think he will be Filipino soon. So I guess he's going to be with us. Are you all excited? Yeah.
Yes.
Yes, yes, yes. Welcome to the
I already
family.
sent you a friend request on Facebook. So much.
Fred Wolfson, yes. And also, ito, grabe Marites. And he has mastered Dung's acupuncture. Dung's pala yun, hindi pala yun Tung's. Oo. And he was asking if we knew something about Dung's. Welcome to the family, Sir Fred.
Thank you. Are you able to hear me? No.
It's a little muffled, but we can hear you.
Okay, okay. Sorry, I'm on my phone here and having some technical problems, but it's nice to meet you all. I can hear most of what you're saying.
It's nice to meet you too.
Yeah. So if you want to join us in the Q&A, Fred, and I'm sure you're willing to share your expertise, you're very welcome. Okay? Let's continue with number 3. Let's call on Ma'am Annalene. Miss Annalene, good evening.
Good evening po, Doc.
Can you take care
So
of...
number 3, yes po. For number 3 question, an 18-year-old female complains of chest pain, insomnia, palpitations, migraine, headache, lower abdominal pain, and distension before and during her period, and an excessive menstrual flow with a dark red color and clot. There is a mass on her neck. The Western medical diagnosis is thyroiditis. What is the pathogenesis?
Can we go
Answer
to the
is
answer?
yes, liver blood stagnation.
Why do you
Yung
say
pinaka-clue
so?
ko po, yes po. pinaka-clue ko dito yung dark red color ng menstrual flow niya with
Okay.
blood.
Excessive menstrual
Yes
flow.
po.
Very good.
Yes.
What else?
Yes po.
What about the mass on the neck?
Yes. Indication din po siya ng blood stagnation.
So what is the
Yung mass
difference
on her neck.
between a mass that's caused by phlegm and the mass caused by blood stagnation in terms of
Cold phlegm po, yung possible. May pathogenic factor. Then may cough siya.
okay. So pag blood stagnation po, most likely the mass is a bit hard, no?
Opo. Opo.
Okay. Very good. Thank you very much, Ma'am
Thank you
Annalyn.
po.
Let's go to number 4 and let's call on can I call on Sir Michael, who is, I think, a dog lover? Was very interested to learn veterinary acupuncture. We take note, if ever this will push through, we will be the first group to actually introduce veterinary acupuncture. So we have to make friends with Fred. Okay.
Hello, Fred.
Michael, can you
Yeah.
take care of number 4, please?
Number 4, a 32 years old male has excruciating pain in his left wrist with a tarsophalangeal joint. It is a red, warm, shiny, extremely tender. It also has chill, fever, malaise, and tachycardia. This laboratory this laboratory test result shows uric acid volume. This is a uric acid above in 7 point. His tongue is red. Yes, it's obvious. It's a greasy yellow coating. And his pulse is rapid and slippery. The question is, what is the TCM diagnosis?
What is your answer?
The answer is letter B, the dam hit B pattern.
Okay.
The dam more
Michael,
on, yeah.
Didn't I tell you that you have to look at the tongue and the pulse first if they were given? From the pulse and the tongue. Did you think it gave you the answer already?
Yes, for this
If
one
you
is
have a
basic.
red tongue with greasy yellow coating, what is the diagnosis?
Diagnosis.
Red tongue with greasy yellow coating.
It's more in more on heat.
And what about the greasy coating?
A greasy coating. Greasy coating.
Greasy.
Yeah.
You were very attentive last Wednesday. What happened? Our topic is greasy tongue coatings.
Yeah, only for this one.
Okay, let me change the question. What about the pulse? Like, what does a rapid pulse mean? Diba I told you, do not waste so much time reading from the beginning. If this one is given, the tongue and the pulse, no? Then afterwards, you can go ahead with the first few sentences. What about slippery coating, a slippery pulse? What is that telling us, Sir Michael?
Slippery pulse in the is
slippery.
Slippery. When you touch this in the surface.
You know what that means. What do you have in mind? Like, what pattern are we talking about? Rapid always signifies heat or cold?
It's a heat.
Okay. What about slippery?
Cold.
Slippery, cold?
No, it's a heat also is a heat.
Why did you answer letter B? What is your basis? You said
My
heat P
uh,
pattern.
is based on water and wetness. Based on my this is internal damage. That's why I chose dam heat. It's a B pattern.
How is it different from wind heat P pattern?
Is more on the heat
How,
pattern is more yellow dense pattern or respiratory problem in constipation.
what will tell us that the pattern is wind heat? Let's say the patient also had joint pain, left first metatarsophalangeal. Take note, the joint is red, so that's very, very heat. Warm, shiny, extremely tender. Yes, chills, fever, okay? So what else? So can you tell us why your answer is damp heat? Why not blood stagnation? Will the blood stagnation
There's
sink?
no blood stagnation. There's no cold because there's a heat.
What is the tongue color if you have blood stagnation?
The color is blood stagnation.
Of the
Red.
tongue?
Bluish. Yes, a bluish tongue. And the bluish tongue in and dry.
So your answer is letter B.
Yes,
Is
because
that
wind
supposed to
heat.
be a guess, or did you think hard about it?
Yeah, it's a different. It's a different with the wind heat because the wind heat
So,
is a more fever and headaches, and there's a lot of respiratory problem. Aside sa dam heat, the dam heat is more on
swelling.
sweating. Yes, wetness.
There's swelling
Wet.
here.
Yeah.
Or are we basing it on what we see on the tongue? So, Michael, if it is wind heat, P pattern, what would you expect to see on the tongue? Would you be seeing a greasy yellow coating?
No.
So, can we say that this was your basis for giving the damp heat P pattern answer?
No, I cannot consider as a greasy yellow coating.
No.
Sorry, the dam heat is more on red and yellow coating. Aggressive yellow coating. Yeah.
So it's dampness, damp and heat.
Yes.
Okay. What does a slippery pulse signify? Kalimutan mo na, ano ba yan? Kala ko ba nakikinig ka nung Wednesday? Parang ano ka? Bakit parang nagkaroon ka ng brain fog? Parang may phlegm din yung utak mo. Buti lang hindi tayo nag-live stream ngayon.
Sorry po.
So that's damp heat. Okay. If it's wind heat, the pain would be migratory. No, it will not only stay on one place. Of course, there's heat, there's red, there's warmth. No. He has also chills. So this is basically an exterior pattern. It's that means he was exposed to dampness and heat. Okay.
External damage po, no? For damp heat.
Yeah, because of the or it is an old problem. So which is which? If we see a greasy yellow coating, is that telling us that the problem is quite recent?
Yeah.
Yes din kayo ng yes. Buti nga wala si Dr. Gavino. Oh, he didn't show up anyway.
Okay.
What did we tell you about an internal? So if this was an exterior pattern, Michael, what would you expect the tongue to show us?
Mm.
Would
It's
exterior,
a red.
di pa pumasok sa loob. Do you
Oo.
expect to see a red tongue, or would you only see red spots on the sides and at the tip? At saka take note, red na yung tongue, ha?
Red
So
na po.
definitely this is not a new problem.
Mm.
Diba? Do
Red
you
na po.
agree, Angel?
Yeah.
This is not a new problem. It's quite, saka take note, ha? Oh. Pero na-aggravate lang because probably he ate something or he went to, yun.
Mm.
It's an old issue. Okay?
Because of also the uric acid, Doc.
Yeah, uric acid. Affected na
Yes.
yung kidney. So you cannot
Yes.
just say na nakuha lang niya ito sa labas. Kasi you were saying here exterior. No. This is very interior. Okay? Yes.
Yes
Red na
po.
yung tongue.
Mm.
Red na yung tongue. Okay? Okay, let's go to number 5. Thank you, Michael. We'll call you again later. Sir AK. AK, good evening. Can you give us the answer to number 5?
Good evening, Doc. Good evening, classmate.
Good evening.
Basahin ko muna, Doc.
Yes, please.
Okay.
And then your choice.
Okay. 50-year-old female patient has had pain in her left elbow for 6 months. The pain is severe and worsened with movement or when trying to grip an object. With her hand, she is unable to work or carry out her daily household chores. A surgeon diagnosed the condition as lateral humeral epicondylitis. Heat therapy provides temporary relief from the pain. Examination shows local tenderness over the left lateral humeral epicondyle. Pain is also elicited by resisting dorsiflexion of the patient left hand. What is the pathogenesis? Basically, yung diagnose sa kanya is usually sakit ng mga tawag din ito yung mga athlete, tennis elbow kung tawagin.
Ay, okay, sige.
My answer is obviously, Doc, sinasabi dito is heat therapy provides temporary relief from the pain.
Okay.
Definitely.
This is the cue. Ito yung nagbigay sa iyo ng answer.
Yes, Doc, na it's related to cold.
So definitely you will not be answering damp heat with blood stagnation.
Yes, Doc.
Kasi pag damp heat, kahit maglagay ka ng heat therapy, walang mangyayari. Damp heat na,
yes,
no?
Doc. Definitely,
So
Doc.
how are you going to exclude wind cold from the choices? Paano matanggalin si wind cold?
Definitely kasi, Doc, pag wind migrating ang pain eh. And this one is not. The pain is severe and worsened with movement or when trying to grip an object with her hand. So nasa isang location lang siya and definitely nagwo-worsen siya kapag dinidiinan. Ano?
No.
So
another thing, Sir AK. 6 months.
Yes, Doc.
6 months
is
na. Wind cold is very exterior, right?
Exterior pathogenic,
Walang
Doc.
kinalaman ang exterior ano. Okay. So
My
yon.
answer, Doc, is letter C.
Okay.
Dahil may pain siya, may blood
That's blood
stagnation definitely.
stagnation. Yeah.
And the cold dampness.
Yeah, sadly, hindi pinakita yung tongue, hindi din pinakita yung pulse, no?
Maybe yung tongue, Doc, is may purple tongue kasi 6 months na eh.
Yes,
Yung kanyang
most likely.
nararamdaman.
Mm-mm.
And meron siyang pwedeng may white thick coating.
Mm.
And pwede rin slippery.
Dorsiflexion
But
of the patient's left hand.
But
How do
definitely
you
purple
demonstrate dorsiflexion?
Sa may kamay sa Doc, dorsiflexion. Sa may
Dorsi.
dorsal,
So masakit.
yes, Doc.
Okay. Actually, masakit talaga to kasi cold eh.
Hmm.
Masakit pag cold. Very stiff. Maraming salamat, Sir AK.
Thank you, Doc.
Okay, can we call on someone from Baguio? Miss Joy Enriquez? Wow, ang ganda
Dok,
ng
pwedeng pass mo muna ako. Nagdi-dinner ako eh.
Oh, sorry. Okay.
Sorry po.
Oh, late dinner. Okay. Let's call on Ma'am Lynn. Lynn Galarita. Can you take care of number 6? Miss Lynn, do you have a good signal? Oh, mukhang wala si Miss Lynn. Let's call on Ma'am Lane Arandia. Ma'am Lane, good evening.
Good evening po.
Okay, can you take care of number 6, please?
Number 6, a 25-year-old male patient complains of a headache lasting 2 days. He says that 2 days ago, he started to feel the headache in the occipital region. The pain is violent, boring, and tight. It
Okay.
extends to the nape of the neck and upper back. His headache gets worse when exposed to wind or cold. He has had chills for the past 2 days and his body temperature is 104 degrees Fahrenheit. Which of the following symptoms might this patient also have?
Okay.
Ito pong letter D.
Ano po yung problem natin? Is it okay kung
Meron po siyang nararamdaman na headache sa occipital region.
So ano po ito? Exterior wind invasion or internal na? 2 days.
Exterior.
Exterior. Lumalala pag exposure sa wind or cold. Occipital headache. Tingnan mabuti. Extending to the nape of the neck and the upper back. This is very common. Okay? Meron siyang chills and fever. Aversion to cold and fever. So, bakit ito yung in-answer mo, hindi yung tatlo? If you answered sore throat, why will that be wrong?
Sore throat po kasi belongs po siya sa mga sa organ po ng lungs. Kapag red eyes naman po, ito po yung related siya sa liver fire, sa organ po ng liver. Pag constipation naman po,
yeah,
more
siguro,
on cold.
Siguro kasi dapat hindi siya wind cold, wind heat siya. Nakita nyo, sore throat, di ba? Pag heat, red eyes, constipation.
Opo, more on heat po itong tatlo.
Yes. Maraming salamat.
Thank you po.
Katawagan namin kayo ulit mamaya. Okay. Let's call on Dr. Sam Rizon. Dr. Sam, good evening. Please take care of number 7, please.
Yes, good evening, everyone. How's my signal, Doc? Is it
Very
okay?
clear po, Doc.
Okay, good. Kasi kanina nag-intermittent signal kami sa lakas po ng ulan ngayon. Anyway, here's the question. A 30-year-old woman comes to our office with a chief complaint of dizziness. When she stands up for her chair, she feels dizzy and sometimes blacks out. She also has numbness of the limbs and muscle twitching. Her menstrual cycle is delayed and her sleep is very light. Sunlight makes her eyes hurt, her face and tongue are pale, and her pulse is forceless. Which of the following signs and symptoms are consistent with her condition? Now, first, the face and the tongue are pale. So this is actually an indication of a deficiency of blood.
Okay.
That's
Good.
why naka-feel dizzy siya.
Yes.
And as you can see, her pulse is forceless.
Okay.
So that is very deficient. That is blood deficiency, and that's directly affecting. Actually, the organ involved is the liver. So I should say the answer is gonna be brittle and pale nails. Yeah, because nails represents also the condition of the liver.
So your diagnosis is what, Dr. Sam?
The diagnosis is, I think this woman has a, what do you call this, insomnia,
Yes.
and it's heat. And as you can see, during sunlight makes her eyes hurt. So
eyes is liver?
Yes. The eyes is liver.
So when you talk about nails,
brittle nails,
if you're
pale
going
nails,
to connect everything, like what
Yes.
pattern are you going to come up with?
So that's very liver blood stagnation.
Why stagnation? Do you?
No, sorry. Deficiency, doc. Sorry, that's
Okay.
deficient.
Okay, why did you not answer lack of appetite?
Well, lack of appetite, it's spleen deficiency. That's very obvious.
Why didn't you answer lumbar and knee pain?
Lumbar and knee pain, that's directly connected to kidney.
Okay. Thank you very much, Dr. Sam. Wow, well-deserved. Talagang, ay wow, grabe. Ang galing. Nako, matutuwa si Dr. I would like to acknowledge the presence of Dr. Romy. You see, kahit bedtime na niya, talagang nag-attend siya. No? Huwag kayong don't be intimidated. And I know naman hindi kayo mapapahiya. Okay. Maraming salamat. Let's go to number 8. Let's go to number 8. I would like to call on Henry Nilios. Sir Henry, good evening.
Hello, Doc. Good evening.
Good evening po.
It's raining sa labas. Maingay. Sige, Doc, number 8, no? Basahin ko na po. Clear ba yung sound, sir? Doc?
Yeah, clear po, clear.
All right. So, 43-year-old female complains of dizziness, fatigue, loose stools, loss of appetite, blurred vision, and numb, tingling sensation in the limbs. Her face looks sallow, and she has a pale tongue and choppy pulse. According to some food diagnosis, what do these indications suggest?
Okay, ano answer mo, Sir Henry?
My answer is spleen and liver blood deficiency.
Why?
Yeah, because I see. So meron kasi siyang dizziness at fatigue. So,
una-una mong titingnan, tinan nyo, di ba sabi ni Doc Sam kanina? Okay. Inuna niya yung mukha. Tinan mo yung mukha, sallow.
Hollow. Is that a sallow hollow?
Ano yung hollow? Mukhang
Aho.
may pagka yellow ng parang maputang yellow ganun. Okay.
So,
Ito I'll give you I'll give you some tips. Tingnan mo muna kung binigay yung tongue, tingnan mo yung tongue, pati pulse. Okay, pale tongue. What does that immediately tell you, Sir Henry? About
pale yung tongue niya is
so are we talking about, okay, lahat naman pala ito deficiency. So wala ka
deficiency.
choice. Ang options natin puro deficiency. So ngayon, ang chance na lang natin yung choppy. No? Anong pattern will give you a choppy pulse? Choppy, parang signal ng globe.
Parang intermittent po yan, Dr. Choppy siya.
Putol-putol, parang kung
So
basta
yung
parang
So tingin ko, Doc, slightly stagnant yung blood niya. Hindi siya well flow doon sa vessel, blood vessel.
pag may nakita kang fatigue and loose stools, loss of appetite, ano kaagad na sa isip mo?
Pag ganyan, Doc, ano siya, overwork siya sa trabaho. Tapos,
So anong organ, anong zangfo ang affected?
Organ. Heart po, saka lungs.
Sure ka? Di ba diniscuss yun na ano ba yung topic nyo last time? 5 elements and yin and yang. Okay. Ano bang trabaho ng spleen? Like, pag ang spleen mahina.
Meron din po siyang, spleen deficiency. Yung masasabi ko. Kasi, meron siyang yung body fluid niya kasi, yung mga respective pathway, yung nagpo-cause ng dizziness niya. I think.
Huwag I think, that's hula. Ganito, so what about itong tingling sensation in the limbs? Na napaka-common po. Ano sa palagay mo ang nangyari dito? Anong zangfu ang affected? Actually, ang choices puro zang puro solid organs, yin organs, di ba? Okay. Bakit hindi letter A ang sagot mo, Henry? Ano bang nararamdaman ng pasyente pag mayroong yang deficiency ng kidney and spleen? Kulang sa yang.
Pag
kulang sa yang, kulang sa init. May nakikita ba tayong symptom dito that points to kulang ang yang? Okay, di ba you do massage? Yeah, Ma'am Lynn said, may diarrhea ang kidney yang deficiency. Di ba? Does this patient have diarrhea during dawn? At dawn? Wala, no? Does the patient have back pain? Sabi kasi ni Dr. Sam kanina, pag kidney, look for low back pain. Wala din, di ba? So bakit hindi letter C ang sagot mo? Ano ba yung una-una nating hahanapin pag may heart chi deficiency? Ano yung pathognomonic of the heart? Merong palpitations yung pasyente, di ba? What about the lung? Shortness of breath, may problema sa boses, malamig yung kamay. Meron ba yan dito sa ating pasyente?
Wala po. Nahihilo lang siya.
O itong kidney and liver yin deficiency, ano sa palagay mo? Like, bakit hindi mo ito sinagot? Di ba pag yin deficiency, meron ng night sweats? So kapag may kidney yin deficiency, liver yin deficiency, medyo pang ano na to, medyo maedad na, di ba? Sa bagay, 43 na rin. Pero usually, pwede na. Pero ano ba yung una-una nating hahanapin? Night sweats. Mayroon ba tayong nakikitang night sweats? May nakikita ba tayong tinnitus? Ringing of the ears? Wala, no?
Wala.
Okay. So, yun po ang sagot. Spleen and liver blood deficiency. So, pag spleen Qi deficiency, we're looking at fatigue, loose stools, loss of appetite, okay? Liver blood deficiency, blurred vision, numb, tingling sensation in the limbs. At saka ito yung given, no? Sallow-faced. So that's very spleen. So you're left between A and B, right? So since walang feeling of cold, yun yung sagot dapat kanina. Bakit hindi kidney and spleen yang deficiency? Aside from diarrhea at dawn, the best would be the patient feels cold. And di ba you're a masseur, you're a massage therapist? Di ba there are patients, when you palpate their limbs, malamig. No? So you might, the patient might have yang deficiency of the spleen and kidney. Maraming salamat, Sir Henry. Don't be disappointed. This is the reason why we
Yeah,
are...
it's part of learning. Doc.
Yeah, I know, because you're like crash course. Sige lang, effort pa, more. Okay.
It's a lifelong journey. to
Yeah.
learn.
Oo. Ang importante kasi andun yung attitude. Imagine, you all braved the rains yesterday, just to attend the lecture of Dr. Webb. Let's go to number 9. I would like to call on Ma'am Lynn. Ma'am Lynn, is your connection okay now? Lynn Galaharita?
Medyo okay na po, Doc.
Okay,
Can you
very
hear me
good.
po?
Bago tuluyang mawala. Number 9.
Okay, number 9. A 43-year-old male patient complains of constipation over 4 weeks. The stools are not dry but small like goat's stools and difficult to evacuate. He was diagnosed with IBS 2 years ago and suffers from alternating constipation and diarrhea. His symptoms indicate which of the following? My answer is liver qi stagnation.
Okay, why?
Kasi yung liver qi supposed to ensure the smooth flow of qi for the entire body. So kung na-impair yun, unang maapektuhan nun the lung qi. So pag naapektuhan yung lung qi, maapektuhan na rin yung descending function o descending movement ng large intestine qi. So magkakaroon na ngayon ng constipation din. Tama po.
Yeah, because the grabing impact ng liver qi stagnation, diba? So it's like the classic wood over controlling the earth, and also wood parang insulting the metal. Do you follow?
Malapit sa akin to, Doc. I have IBS.
Okay, so can you relate? Is that relatable?
Yeah. Yes po.
Okay, this is what
I
probably
suffer
what
from IBS.
Okay. Okay. Ganito let's try to connect the dots. You have
Can relate pala.
Okay, liver qi stagnation. Okay, for those who are still, the 5 elements yung inattend you last time, okay? Yung relationships. So, what controls, okay, liver, we all know is wood, right?
Yeah.
Okay. What controls the wood element? Anyone? Dali. What element controls the wood?
Lung.
Lung.
Lungs.
And
so it's metal.
Metal. And who is the partner? Okay. So we're looking at a lung that is so compromised because it is being insulted. No? Kasi supposedly, it should be the lung controlling the liver. But in this case, this is called the Wu cycle, right? So medyo na insulto.
Nobody
Oh, matindi kasi si liver chi eh. Kaya pag nag-stagnate yan, super init, so you'll be looking at a lung that is so compromised. Ano ba mangyayari pag masyado nang depleted yung yin? So magiging yang na siya, di ba? Can you follow? So we're looking at the partner. And who is the partner of the lung? The large intestine.
Large intestine.
Okay. So I don't think I need to. So Timog, having goat stools, and this is a very chronic thing, IBS of 2 years, alternating constipation and diarrhea. Okay. Very good. Thank you very much, Ma'am Lynn. Let's go to number 10. I would like to call on Ma'am Jeliza. Miss Jeliza, good evening.
Evening po, Doc.
Oh, kaya mo to.
Number 10, Doc. 45 years old, female complains of constipation and fatigue after bowel movement. Her stool are soaked and she also perspires easily and has a pale tongue. What is the diagnosis? The answer, Doc, is what's the answer?
Okay, tingnan nyo kaagad ang tongue. Tingnan mo kaagad yung tongue. Ano itsura ng tongue?
Pale, Doc.
So, pag nakita mong pale tongue, ano kaagad yung diagnosis mo?
Deficiency, Doc.
Oh, deficiency.
Deficiency.
Saka take note, napagod siya after siyang dumumi.
Opo.
Ha? So, ibig sabihin,
Deficiency.
yes, stools are soft. So, what is your
Opo.
answer? Alin dito sa apat ang deficiency?
Letter D, Doc.
Yung iba excess, no?
Po.
So, yung sagot?
Chi deficiency, Doc.
Okay, very
Because
good. Thank you, Ma'am Jeliza. Napakadali, di ba? Okay, thank you very much. Let's go to number 11. I would like to call on... Nakatapos na kaya kumain si ano. Okay, let's go to Ma'am Angel once again. Ma'am Angel, can you take care of number 11?
Yes, Doc. Number 11. A patient complained that he has thirst, drink a lot of water, has excessive appetite, bad breath, swollen and painful gums, and a burning sensation in the epigastrium. What is the diagnosis? Answer ko po is letter A, yung stomach fire bleeding. Kasi po,
okay. Ang dali, no? Ang bilis. Ito pala, oh, burning sensation.
Swollen and painful gums.
Okay. Painful gums. Yeah, very good. Gums would always tell you that the stomach is involved, right? Naku, naglalag na si Ma'am Angel. Nagmukha na siyang AI. Okay ka lang? Ouch. O sige, okay lang. Medyo mahina na. Ano ba? May bagyo yata. Grabe. Okay.
Doc, narinig po ako, Doc?
Yes. Pero hindi ka gumagalaw. Para kang nagkaroon ng glitch yung... Sige, okay lang, okay lang. So the answer is stomach fire blazing. Nawala na si ano, no? Nawala na. Okay, would you like to take over, Miss Jeliza? Kasi ang dali lang ng question mo kanina. Okay, may tatanong lang po ako, ha? Okay, bakit hindi letter C ang answer ni Miss Angel? Bakit hindi spleen chi deficiency? Kung ang sagot natin spleen chi deficiency, ano yung hahanapin nating symptoms?
Poor appetite.
Yeah. Poor appetite, fatigue, easy fatigability, loose stools. What about liver fire invading the stomach? So this is a classic example of earth over controlling the wood over controlling the earth, di ba? So let's say super galit ka. So affected. How will the stomach be affected? Ano yung magiging sintomas? Ano dyan na si Ma'am Angel? I was asking them, can you hear me,
Dok,
Miss
nawala.
Angel?
Yes,
Okay
Dok,
lang?
narinig ko na.
Okay. Ano magiging symptom if liver
Kapag-
are invading the stomach?
Kumbaga, sir, parang kapag ang liver fire invading stomach, magkakaroon po siya ng acid reflux, vomiting,
Okay.
and bitter taste in the mouth.
Oo, kasi ano ba yung normal flow ng stomach chi? Downward, di ba? Descending.
Normal flow po kasi ng stomach chi, downward po siya.
So pag
Yes po.
pag affected siya ng liver
So
fire,
parang
pag humina yung
na-insult po
stomach
siya
chi,
ng liver.
magre-rebellious. Magkakaroon ng
Yes po, nagkaroon po ng
reflux, magkakaroon ng
rebellious
vomiting
chi po.
or hiccups. Okay, very good. Let's go to number 12. Let's call on Ma'am Ami. Ma'am Ami, can you take care of number 12, please?
A 32 years old male presents with burning epigastric pain. He also has empty and uncomfortable sensation in the stomach with hungry but no desire to eat. Hiccups, tears, and constipation. His tongue is red and dry with little coating, and he has a thin rapid pulse. What is the most appropriate TCM diagnosis for him? Answer, Doc, is letter A, stomachin deficiency.
Will the tongue and pulse be enough to give you... Mabilis na, no? Red tongue, dry.
Hunger but no desire to eat po, Doc. Yan ang pinaka ano po.
Yun ang Okay,
Yes
no
po.
desire to eat. Thirst. Okay. Thank you po.
Okay.
Correct answer is A, stomach indeficiency. Let's go to number 13. Let's call on Michael. Sir Michael? Would you like to give this another shot? Sir Michael?
Hello po. Hello.
Okay, number 13 po, please.
Please. Number 13, a 40-year-old female has had dull epigastric pain for over 20 years. 2 years ago, she was diagnosed with an ulcer in the duodenal bowel with chronic superficial gastritis. The pain radiates to her back and is accompanied by nausea and regurgitations of clear fluids. She has a poor appetite, a dull sense of taste, and a preference for hot beverages. The pain is alleviated with a local pressure. His stool are sticky loose. She has a pale tongue with thin white coating and deficient pulse. The question is, what is the pathogenesis?
Answer.
For this one is a spin-yang deficiency with cold. Letter B po, stomach spin-yang deficiency.
Yeah, what made you choose that answer? Can you show us? Ito ba? Hot beverages? Or is it the loose stools? Pale tongue with thin white coating? Pale tongue.
A pale tongue white coating po, Doc, is as a normal tongue. But there's a deficient pulse. It's usually is a pulse, a weak pulse. So that's why I consider letter B as stomach spin-yang deficiency with cold.
Okay, very good. Letter B. Maraming salamat.
Yes,
This is easy, I'm sure. Number 14, let's call on Ma'am Lane Arandia.
Hello po.
Yes.
Number
14.
14, a patient has had diarrhea and fever for 2 days. The symptoms include abdominal pain, tenesmus, blood, and mucus in the stools, and a burning sensation in the anus. He is thirsty and passes scanty, deep yellow urine. His tongue has a yellow sticky coating, and his pulse is slippery and rapid. What is the diagnosis for this patient? Balik to pong pipiliin pong large intestine dump heat dahil po ang kanyang urine is yung kanyang tongue coating po is yellow sticky coating, dump heat po siya. Tapos ganun din yung pulse is slippery and rapid. Heat po siya kaya dump heat. Tapos yung kaya large intestine dahil po yung blood and mucus in the stools.
Okay.
Opo.
Kaya hindi po pwedeng letter A.
Apo.
Hindi din po pwedeng. Pag ang sagot letter C, bladder dump heat, ano magiging problema ng patient? May problema na sa pag-ihi, di ba?
Opo, yung yung urine niya po. May problem po sa pag-ihi niya po.
And also, pag meron kang heart fire transferring to the small intestine, medyo mahirapan ng umihi, burning, no? Alam niyo ba yon? Kasi po, ang small intestine, ito po yung capillarity ni bladder. Remember? Small intestine and bladder?
Apo, sa
Greater yang.
partner niya po.
Yes.
Tayang.
Very good. Good. Thank you. Let's go to number 15. Let's call on Sir Henry once again. Sir Henry Nilios, please.
Okay, Doc. It's me again. Number 15, 30-year-old male patient has not had a bowel movement for 4 days. Before that, he also had constipation with dry stools. He tells you that he is passing dark and scanty urine. He also witnessed restlessness, a red face, dry mouth, foul breath, and abdominal fullness. His tongue is red with a yellow dry coating, and the pulse is slippery and rapid. What is the diagnosis of this patient?
Okay.
Letter A, it says heat in the stomach and large intestine.
Okay. Kasi, red face, tongue is red, yellow dry coating, pulse. So definitely, hindi po pwede yun ang sagot mo kasi pag lung heat, di ba? Magkakaroon po ng, wala namang ubo, di ba?
Wala po. Wala siyang ubo.
Dryness of the large intestine. Pwede, pero it doesn't necessarily mean na pula na yung mukha. So there is excess heat. Ano pong itong stomach and large intestine? Ano po yung kanyang channel? Do they belong to the same channel? Are you familiar with Yang Ming channel?
Large intestine is yang channel.
Yeah, large intestine and stomach. Bright yang. Okay? Ito yung mga organs na kailangan maingat tayo kasi grabe yung yang nila, no? Super yung yang. Kaya mabilis mag-heat. Kaya yung tinatawag na bright yang, no? Okay, maraming salamat, Sir Henry. Let's go to number 16. Let's call on... Tapos na kaya kumain si Ma'am Joy? Give it a shot, Miss Joy.
Pwede pong sa question 20 na ako.
Sige, go. Ay naku ha, baka nagdi-dessert ka pa. Okay. Di ba magda-diet ka dapat?
No! Buti hindi pa ako muha eh.
Sige. Lumiit ka na ba, Miss Joy?
Joke naman. Hindi pa.
Okay. Ang tagal mo kasi kumain. O sige, tagal mo matapos kumain. Okay, let's go to number 16. Let's call on, sino pa ba hindi natatawagan? Dr. Sam once again.
Yes,
Maybe you
Doc.
can take care of 16 to 20. Let's see.
Oh, yeah.
Okay.
Okay, Doc. Well, let's try. All right, now, liver 3, or ano ba, how do you pronounce this? Tai Chong? Can be selected.
Tai.
Ano,
Tai Chung. Wag nyo na lang i-pronounce yung pin-in. Just, it doesn't concern us for now.
okay.
Tai Chung.
Okay, liver 3 acupuncture point can be selected as a supplementary point to treat vomiting. Due to, well, attack. I can see the attack of stomach by liver chi. And we use liver 3 because this is actually liver 3 is the one source point of the liver meridian. So this is very useful for abdominal distension, pain in hypochondrium, hiccups. So kasama na po doon ang rebellious chi of the stomach.
Marami
So
kang pasyenteng ganyan, no? As a naturopath.
Opo, Doc. Dami. Isa na rin ako dyan noon.
Okay. Kaya pala. So, dapat ubusin mo itong mga questions. So, correct answer is attack of the stomach by liver chi. Kasi sobrang iinit pag nag-stagnate yung liver chi, no? Especially pag emotionally stressed out ka, no? This can impact the stomach so much. So you need
to my personality rin, Doc, na isa rin akong wood personality. So
yeah, I know you want to make things happen, no? You always make things happen. Okay, number 17.
Wow. Okay. So which of the following prescriptions do you consider as the best one for a patient complaining of vomiting? Loss of appetite, lassitude, weakness, and how to say, slightly loose stool. Okay, let me see. I think it's Rent 12 is for Rent 12. This is a front move of, I think, the stomach. Yeah, front move of the stomach. And this should be, since vomiting, we need spleen. I think spleen 4. And then pericardium 6 also. So the answer is letter A.
Yeah, we have letter A lang mayroong bakshu, di ba?
Yeah, mayroong bakshu ng itong bladder 20 and 1.
The others do not have bakshu, right? Because if you have a patient who comes in with loss of appetite or slightly loose stool, you don't see that happening lang overnight, diba? There's no exposure to anything. So that means this has been going on for quite some time, right? So lassitude, weakness, vomiting. So vomiting pa lang, you would think of what organ already?
We think of, if vomiting is stomach. So kaya meron po tayong bladder 21. So the bakshu of the stomach and bladder 20, the bakshu of the spleen because of this loss of appetite.
And lassitude, weakness.
And lassitude, yes.
Yeah, okay. So how would you classify spleen 4 and pericardium 6?
Spleen 4. Pericardium 6 is ano ba yung pericardium 6? Dami kong it's a low connecting point ng pericardium.
Yeah.
I think, yeah.
And usually in cases like this, we combine spleen 4 and pericardium 6. No?
Magkasama sila.
Magkasama sila because they try to take care of the yin. No,
And also that can harmonize the stomach.
Yes, very good. Okay. So the best answer would be letter A.
Letter
Let's
A.
Number 18.
Okay, which of the following points are the most commonly used for treatment of hiccups? Paborito natin to.
Yeah. Actually,
Yeah.
no, bakit pa ganun ng mga massage therapists? Parang nagkakaroon, hindi lang hiccups, belching, ah.
So, yung sa nakita ko dito sa points daw, that catches my attention for hiccups, I would go for pericardium 6 kasi lagi kong ginagamit yan.
And it helps.
Yes, it helps actually because it is what do you call this? It's very best for hiccups, and this one also the bladder 17. Yeah, the bladder 17. I think the answer is letter C, and that's for sure. Because
Bladder
pericardium
17 is what? It's supposed to be the back shoe for the diaphragm.
Bladder 17 is the back shoe for diaphragm, yes.
Yeah. And if your diaphragmatic muscle is weak, may chi deficiency ka, or may, ano ba tawag ito? Nag-rebel yung chi mo.
Yeah, rebellious.
Yeah.
In fact, kaya po yung mga masseur, yung mga nagmamassage, nagre-reflex, habang sila po yung nagpipress, hiccup po sila ng hiccup. Dahil po doon sa pressure na kanilang ina-apply. And it would affect the diaphragm.
Tanungin nga natin yung mga magagaling natin LMTs.
Oo nga, mga LMTs
Liza,
din.
totoo ba yan? Meron kasi ako nakitang practitioner. Every time
Yes,
siya...
Doc. Kasi Doc, yung pressure po, kinukuha rin po sa lungs kasi kinukuha rin po sa upper back.
So kailangan nineedle mo yung bladder 17 mo and PC6.
Opo, para po sa chi, sa bladder 17, sa bloodstream po yun, di ba, Doc?
Kasi ang pericardium 6, napakaganda niya mag-regulate ng chi, di ba?
Yes, Doc. Sa
yung chi.
connecting point po.
Oo.
Bali, Doc, kasi po ang massage therapy, kagaya ko, 13 years, going to 14 years massage therapy. Po siya? Bali po yung pressure po namin sa thumb, sa mga tip of thumb namin, yung the palm, kinukuha po namin sa upper extremities po namin, hindi po sa weight din. Yun, kaya sumasama na rin sa stomach.
Okay, pero
yung weight
payat ka
namin,
dati.
binilagay namin sa pressure.
Slim
Opo,
ka
yung
daw
weight
dati.
namin nilalagay namin sa thumb. Yes, Doc.
Slim ka daw dati?
Ay, sexy.
Okay. Sige, di bali na. Let's go to number 19. Thank you, Dr. Sam.
Okay. Yes, number 19, ito, bladder 17 is utilized in the treatment of hiccups because it's obvious. It is actually can descend chi or can stop the chi from ascending.
Yeah.
Yan po ang trabaho ng bladder 17.
Oo. Siguro kung ipapalpate natin yung kanilang bladder 17, no, ng mga, I'm sure si Sir Henry din nagmamassage, di ba? Or humihila ng ulo, bone setting.
Before, Doc, nagmamassage sa Singapore.
Oo. Pero ngayon, gaganon ka rin, nag-hiccups.
Madalang na lang, Doc. More on, bone setting.
Very good. So, ano po ibig sabihin ng influential point? So, pwede nating sabihin na bladder 17 is the influential point of the blood.
Yes, Doc.
So, is it something that exerts a profound effect on the functioning of the body? So, which makes sense, diba? And there are 8 influential points. And we shall take up all of them when we discuss the channels, the point categories, no?
Point categories.
Yeah. Number 20, Sir Dr. Sam.
Number 20. All right. Number 20, apart from principal points such as bladder 17, TC6, and REN12. Which of the following points would you select as supplementary points to treat hiccups caused by the stagnation of qi? So, pag stagnation of qi, I go for liver 3. So because the qi of the liver is, the direction is, tawag nito, in every direction, multi-directional, kumbaga. And I go for Ren, teka.
Yeah. Is it
Yeah,
true?
Ren 17.
Ren 17 is the influential point or the C of Chi?
C of Chi, yes. And
So
then
makes sense,
the
diba?
Ren
It
17
makes
is
sense.
the, so that also opens the chest and tonifies and regulates lung Chi.
So do you think we can use this on all LMTs? Blood
Yes,
seven-
magamit nila ito. O kasi actually
nga.
ang Ren 17 can subdue rebellious lung Chi.
Yes. Yeah. I believe so. Yeah. So, okay.
Our answer is letter A.
Yeah, very good. Correct answer is A. Ren 17 and liver 3 together with bladder 17, pericardium 6, and Ren 12. Okay, thank you very much, Dr. Sam. Let's now call on Ma'am Lynn bago siya mawalan ulit ng signal. Ma'am Lynn Galarita.
Okay.
Can you take care of 21 to 25?
Okay po.
Yes, na.
Okay.
This is very important. Acute diarrhea.
The best prescription for the treatment of acute diarrhea is, I would go for the points na nasa harap. Kasi for acute, siya. So, stomach 25, the front view of the large intestine. Ren 12, the front view point of the stomach. And then, yung stomach 36 and spleen 9, letter A po.
Okay.
Spleen 9 is the what of the spleen. So, mga intestinal points.
Okay. Let me share you. I don't know kung naalala nyo pa, no? When you talk about, I'm sure you're familiar with the C points. Who C point? Diba? Yung 5 point, yung 5 shoe points. The 5th one is the C point.
Shoe.
The who C point or who C. The C point, dagat, no? So actually the C points are very good for rebellious chi and diarrhea, no? Yeah, so dito, so every time you have diarrhea, acute diarrhea, you would always think of the C points. So like stomach 36 and spleen 9. And since this is acute, acute siya, so you would be looking at the front move, no? The alarm points. So stomach 25 is the front view point of the large intestine. Ren 12 is the front view point of the stomach. Does that make sense? Yes. So the answer is
yes.
Let's go to number 20. Ma'am Lynn. From diarrhea, we go to dysentery.
Dysentery. Dysentery, yung diarrhea with blood and mucus.
Mucus, yeah. Infection of the, yeah.
So, this is related to damp feet. So I would go for stomach 37, which is the point of the sea of blood.
Yes.
And the lower Hosi point of the large intestine, and the front point of the large intestine, which is the stomach 25.
Okay, very good. So the answer is letter B. So blood and mucus.
Yes po.
Okay, very good. Let's go to, that's actually damp heat, no? Number 23, Ma'am Lynn.
Yeah. Okay, number 23. Stomach 25, stomach 37, REN 12, and pericard 6 are best prescription for the treatment of resistant dysentery.
Yeah.
Kasi itong
Because,
mga points na to po, they regulate the stomach
yes,
and keep the
definitely not
adverse
damp heat.
chi downward.
Yes.
Uh,
Kasi hindi siya pang damp
yeah
heat actually. Hindi din siya pang cold damp. No? Okay, let's go to number 24.
Number 24. Number 24. The prescription of stomach 25, stomach 37, bladder 20, bladder 21, REN 4, and stomach 36 is commonly used to treat, I think it's intermittent dysentery or parang ito yung chronic po na
Chronic.
dysentery.
On and off. Intermittent. So, ibig sabihin matagal na, no? Chronic.
Action points.
Yeah.
Opo.
Nawala na po sa Zoom. Namatay na. Wala
Bladder 20, bladder 21. And REN 4 is supposed to be the front move of the small intestine, di ba? Stomach 25 is the large intestine, front move, right? Stomach 37, dapat nalaman natin lahat, is the Hosey point of the LI.
Lower Hosey point of the large
Lower Hosey
intestine.
point, yes, very good. And number 25,
Number
abdominal
25.
distension.
It's to treat abdominal distension except spleen 6.
One. Hindi naman effective sa distension yata.
Wait lang. Spleen 6, Doc.
Except.
Kasi lahat to stomach points, Doc eh. REN 12 sa front view ng stomach. Tapos stomach 25, front view din ng spleen. Ay, ng large intestine. Lower Hosey point, pang chan din ang ano niya.
Okay.
Parang lahat to except spleen 6, mas pang stomach problems ang ano niya, concern.
You're very prepared for the next chapter, no? Alam nyo, for module 3 siguro we'll start including ano. You know, I was thinking for week 10 or week 9 next week, I'm going to share with you already the, gusto nyo na ba yung intake form? You have to start filling out the intake form. And then we're going to show you a comparison between the intake form and the doctor's, ano, yung patient form ng doctors. This is what PITAC wants us to do, for you to, you know, get the best of both worlds. Okay? Para we can already align ourselves with the medical people. Okay? Isn't that exciting?
Okay.
So next week, we will start with the acupuncture intake form. And then on the 10th week, kasi ang dami nyo nang alam eh. No, sa totoo lang, for module 3, the patterns, we will have to go by siguro the best one would be Zhangfu organ patterns, no? Wouldn't that be great? And at the same time, we're already going to study the channels as well, the points. Paulit-ulit lang yan. Okay, so alam niyo na ba yon? Module 3 is all about syndrome or pattern differentiation. This will set you apart from the others. Pero dito na natin, i-incorporate ko na dito yung ating mga basic anatomy, physiology, blah, blah. And then also for module 4, we're going to do the channels. We will focus more on point categories, We will also discuss the divergent channels, yung mga channels na hindi masyadong dinidiscuss, like the extraordinary vessels. Okay? Their psycho-emotional component, all these things. So that for Module 5, I'm sure you're all excited. Konting tiis na lang talaga. Okay? Maraming salamat, Ma'am Lynn. Thank you very much. Let's now call on... Sino pa bang? Okay. Ma'am Ami, 26 to 30. Kasi yung iba, madali na lang. Matatapos na tayo ng 10. Ma'am Ami.
26. Okay, Doc. 26, REN 12 combined with stomach 36 and stomach 25 combined with stomach 37 are both combinations of front mu point and lower hisi point. Letter B.
Wow, very good. Easy. Number 27.
Number 27, which of the following prescription is the best one for patient with the following signs and symptoms? Abdominal distension relief by pressure, Borborygmus, loose stool, loss of appetite, lassitude, listlessness, a failed tongue with white coating, a forceful pulse.
Less. That's forceless.
Forceless pulse. 27 is letter C, REN 4, spleen 3, REN 12,
Can I
and stomach
ask you
36.
something? Pag meron kang borborygmus, what is that telling us? Anong food organ ang affected? It's the small intestine, di ba? And which of the points is known as the front mu of the small intestine? Di ba it's REN 4. Diyan na naman siya, natatakot na naman. And what about spleen 3? Anong classification is spleen 3? Remember spleen 3?
Shoestring.
Yeah, shoestring or Yuan Sor.
Yuan source point.
Okay. What about REN 12, Ma'am Ami?
REN 12 po is
Front mu of?
REN 12.
Alam nyo, ganito na lang. You have to really internalize the points so that when you see Dr. Webb, all you have to do is how to needle the points by knowing the exact location. No? And I'm sure you had great fun yesterday, diba? Some of you. Okay. Number 28, Ma'am Ami.
28. All of the following points are main points for the treatment of prolapse of rectum, except for LI4.
Bakit? Para saan si LI4?
LI4 po is good for face and head.
And also for
toothache and
dispelling the wind, no? Pang-release ng wind.
Mga pain.
Okay. Number 29.
Number 29. Which of the following channels has points commonly selected to prolapse of rectum? Do channel.
Okay, very easy.
Channel.
Particularly what point?
Ang do channel po is for
Yeah, anong point?
Maganda po siya sa do one.
Okay, wow. Parang ginawa nyo na yan, no? Okay. Number 30.
Number 30. All of the following can cause edema, except invasion of the wind upon the lungs. Letter A, invasion of the wind upon the lung. Letter A.
Yan ang accept mo?
Accept po.
Let me see. What exactly happens pag pumasok yung wind sa lung? Di ba the lung is connected sa muka? It can
Opo.
cause facial edema, di ba?
Sa mukha.
So are you saying na, okay, who has another answer? Okay, if you have invasion of the dampness which affects the function of the spleen, it can also cause edema. If you have a weak kidney chi, you retain fluids, you retain the urine, then you'll have edema. No, spleen chi weakness as well because hindi nagta-transport, no? Okay. When you have sinking of the spleen and stomach chi, you will have prolapse. You remember? Prolapse, hindi edema. So, when you have invasion of the wind upon the lung, it can cause edema of your muka, of your face. Okay, so that is not the accept there. Okay, so any comments? Do you have the same answer, Ma'am Annalene? Ano answer mo, Ma'am Annalene? Ano yung accept dito? Kasi ang accept ni Ma'am Ami is A. Okay, C is the answer. Okay? So, please read on that, Ma'am Ami. I know you're a little bit confused. Baka nag-overstudy ka. Anyway, only one mistake. No problem. So, can I call on Ma'am Annalene to take care of 31 to 40?
Yes po.
Ay, nako na. Very
Number
easy.
31, watery diarrhea with abdominal pain and borborygmus suggest. Na-mention nyo na po ito kanina. So, it's
Yes.
small on the small intestine, so cold and dampness in the intestine, letter D.
Okay.
That's for
very-
31.
Okay.
For 32, loose stool with undigested food suggest. So this is deficiency of the spleen yang, letter A.
Okay. So spleen yang deficiency is the worst scenario
Yes
of
po.
spleen chi deficiency.
Oo,
Actually,
magkakaroon na ng edema.
can you imagine undigested food? Yung kinain mo na talong, na torta, ganun, paglabas, talong pa rin.
Yes.
Ganun siya
Apo.
kalala, undigested. So that means meron na po siyang spleen yang deficiency. The next po,
Number 33, slight abdominal pain, borborygmus, and diarrhea once or several times each morning at dawn suggest it's letter B, deficiency of kidney yang. So, kidney yang deficiency.
okay. May isi-share lang ako ha. Okay, di ba minsan, I'm sure some of you can relate here. May naririnig kayong sound, no? May orchestra tumutugtog sa tiyan. Kasi I think I have that sometimes. Pero now medyo naayos na when I started doing a lot of walking. But anyway, so did you notice that you also have back pain? Kasi
Yes,
the
po.
small intestine has the same polarity as the bladder. Remember? Oh, bladder and small intestine. Greater yang or Tai yang. Okay? So number 30, saan na tayo? 33, no? 34.
Yes. 34, diarrhea with yellow, hot, loose, and fetid stools suggest. So, merong ano po, yellow and hot. So, it means dampness and heat. So, loose stool, damp heat po yan in the intestine,
Wow.
letter C.
There is amoy. So dapat walang amoy
Yes
yung
po.
stools natin. Kasi kung may amoy, definitely there's damp heat. Okay, 35 to 37.
35, may cause mental restlessness and give rise to palpitation insomnia, irritability, anxiety, and even mental disorder. So this is excessive joy or fear and pride. So yun yung pwedeng emotional niya, excessive joy or fear.
Okay. Mental disorder, ha?
Opo.
Kaya hindi maganda yung too much joy.
Yes, and fear.
Yeah.
So, nanat ng chi.
Yeah.
Correct.
Number 36. Parang may
36 may cause dysfunction of the liver and its ability to promote unrestrained and patency of vital energy. This in turn will give rise to pain and distension in the coastal and hypochondriac region, mental depression and irascibility.
Totoo
So
yan,
this
diba?
can be excessive anger po, letter A.
Okay. Very complete. Number
So, for
37.
liver.
Yes.
37 may cause dysfunction of the spleen and stomach in its function of transportation and transformation and cause anorexia and abdominal fullness and distension after meal. So this is letter B, excessive grief, melancholy, and meditation. So nagkakaroon na ng dysfunction sa spleen and stomach.
Yeah. Too much meditation. Ano yan? Daydreaming. Okay.
Possible.
Number 38 to 40. Ay, very easy.
Number 38, a patient with a red complexion suggests, syempre pag red complexion,
Yes.
extent of heat, letter A.
39,
39, a patient with a bluish-purple complexion suggests, so pag bluish-purple, severe pain and blood stagnation.
Okay.
Bluish-purple,
Very
okay.
easy.
Number 40, a patient with a pale complexion suggests, so kapag pale complexion po, this is deficiency of blood or
Ang galing.
existence of cold, letter B.
Okay, very good. So, maraming salamat. Good
Thank you
job.
po.
Let's call on Sir AK. Sir AK, gising ka pa ba? Tapusin mo na 41 to 51. Alam ko this is, you see, did you notice the questions keep repeating and repeating, no? Hanggang sa magmarka sa mga utak natin yan.
Okay, Doc. 41 to 43. Number 41, a white sticky tongue coating usually suggests sticky is pwedeng cold damp or phlegm and dampness. The answer is B and C.
Yeah, two answers,
Okay,
no?
Yes, Doc. Pareho silang merong kasi sticky tongue eh. Opo. Phlegm and dampness. Number 42, a thick white tongue coating usually suggests retention of food.
Okay, so now you know. So sino nakaka-relate dyan? Tingnan yung mga ano. Alam nyo ba bakit nagre-retain ng food? Yung mga nagre-retain ng food, gutom pa rin. Diba? Kailan? Parang ngumiti dyan. Nakikita na. Okay, number 43.
Number 43, a dry white coating usually suggests invasion by pestilential pathogens.
Okay, very good. Number 44 to 46. We're almost
44,
done.
usually suggests persistent accumulation of the food in the stomach and intestine.
Okay.
A thick yellow tongue coating, letter B. Number 45, usually suggests invasion of the lung by wind heat. Usually suggests accumulation of heat in the stomach and intestine, which results in damage to yin.
Okay.
Okay, number 45, the answer is letter A, a thin yellow tongue coating. State dito yung
basta
windheat
invasion,
siya.
di ba? Invasion.
That's why thin pa siya.
Actually, mahirap pag wind cold, di ba? Thin white coating pa rin. But if it's thin yellow coating, it could be wind heat. Okay.
Wind heat. Number 46. Interior or blockage of the lungs by phlegm heat. So it is a yellow sticky tongue coating because of the phlegm heat, and it is a top heat in the interior.
Okay.
Yellow tongue coating. No. Sticky tongue coating.
Sticky. So, bakit
Sticky.
mali si letter D? Kasi nga merong phlegm.
Yes,
Tricky,
Doc.
di ba?
May phlegm na siya eh. That's why meron na siyang sticky.
Oo,
Not
pag yellow
only
tongue
the
coating lang, it will be heat lang, no? Okay.
heat lang, Doc. Opo.
Ang galing nyo na, grabe. You're so good. Next, the last one. O, ito, pang-finale.
47. The symptoms indicating being affected by pathogenic wind include...
O, yan.
Okay. Nasal obstruction, soreness, or itching of the throat.
Okay, the pathogenic wind dito is heat. Wind heat, no? Kasi kumatin na... Ay, hindi pala. Ay, hindi. Yeah, pwedeng sore, pero hindi siya mapula, hindi siya dry. Okay. Okay, continue please. 48.
Okay. Number 48. The symptoms indicating being affected by pathogenic cold include this one, Doc, letter A, diarrhea with undigested food in the stool and clear urine in increased volume. Very cold.
Yes. Okay.
Okay, number 49. The symptoms indicating being affected by pathogenic dampness include, ito, Doc, heaviness, damp, very damp, and sensation of distension in the head as though it were tightly bandaged, and a sticky and sweety taste in the mouth.
Okay. You have to ask
Very
this.
clean.
You have to ask this sa patient nyo. Parang nilagyan ng bandage yung ulo. Parang naka-helmet na naka-ano talaga ang sikip-sikip sa ulo.
Usually, Doc, sa panahon ngayon, di ba, yung mga nakakaranas, Doc, ng trangkaso, ang tawagin natin. Because of the climate natin dito, yung humidity, yung singaw ng lupa, naapektuhan po yung katawan ng tao, lalo na yung mga puya, tapos mainit at biglang uulan, isingaw yung lupa, and that's very damp.
Yeah. Yes. Good. Good observation. Number 50.
Number 50. The symptoms indicating being affected by pathogenic dryness. That is letter C, rough and chapped skin and dryness of the throat. So, very dry.
Okay.
Yung kanyang description. So, number 51, the last, the symptoms indicating being affected by pathogenic fire include letter E, carbuncle, furuncle, and ulcer with local heat and redness, swelling, and pain. It's very fire.
Okay.
Letter E.
Yeah, I think we're done. Thank you very much for joining us. How is the rain in Manila?
Heavy, Doc. Heavy in Cavite also.
Nag-stop na ngayon. Naka-stop na.
Ambon na lang.
Damn cold po. Damn cold po.
Damn cold.
Okay. Did you ever look at your tongue?
Kahapon, damp heat.
Grabe, no? But anyway, in spite of the rains, tuloy-tuloy pa rin tayo. Hindi na namin tinuloy yung ano muna ha, yung ating live streaming kasi
Live
parang
streaming.
hindi
Hindi
maganda.
pa tayo handa.
Baka mawalan tayo ng viewers. Parang
Hindi pa tayo handa.
baka magmumukha tayong tanga, no? Okay.
Ay naman po.
Congratulations everyone. We're almost done with module 2.
Galing nga po nila eh.
Yeah, ang gagaling. Kaya ano, Ma'am Joy, you have to make habol. You have to watch all the videos and if you can do so.
Any
Anyway,
tips how to memorize?
just keep
Ano po bang pwedeng point? Meron bang point?
no, actually sige lang.
Maybe
You
39,
can always make habol. Alam niyo naman yung approach
37.
natin. I think by this time you have already observed that the way we do assessment, we keep repeating and repeating until masuka-suka na kasi paulit-ulit, no? Tingnan niyo si Oo, Sir Michael, how are you? Are you enjoying the journey so far?
Opo, Doc. Sadyang ano lang po, Doc. Puyat na talaga. In the past few days. Kasi just sa isang legal item.
Kasi pag puyat, ano kaya ang magiging pulso mo pag puyat? Are we going to have a deep pulse or a superficial?
Wiry.
Sige. Are you already practicing pulse and tongue?
Ako, Doc, dandahan ako nag-practice ng pulse at saka tongue.
Yeah. Sometimes you develop your own technique, di ba? Yeah, okay. Very good. Practice makes perfect. So,
kailangan po.
Oo. So, matulog na po kayo. Maraming salamat po. Saka na tayo magano. I will let you know if we are all ready for if we can go live streaming.
Live stream.
Pero parang gusto ko magaling na si Ma'am Joy na hindi na magre-refuse.
Gagaling yan.
Magaling naman si Ma'am Joy.
Oo, sa totoo lang yung module 3 is all about patterns, no? This is something that everyone should be. Of course, when you discuss the patterns, you have to also discuss the tongue and the pulse and everything. So it's basically like studying the cases already. What about Ma'am Lynn? Si Ma'am Lynn, ang dami ng alam. Very masipag. Pati parang na-internalize siya yung mga cases. Pati siya nagkaroon parang nakaka-relate.
IBS. IBS.
Okay. So maraming salamat sa inyong lahat. I can see you're all smiling now. I don't know if that's because we did not go live on a live stream. Sige lang, ano na tayo mag-live stream. Galing natin next
Pag
week.
mag-live stream po, mag-aayos ako ng buhok.
Naka-live tayo eh. Kinabahan naman ako.
Hindi na, parang mukhang, ako kasi, when I plan something, I could feel if it's going to work or not. No, so kahapon the attitude was like parang sabi ko parang iba yung feeling ko ngayon. I don't know if it's the rain or I just felt na some of you will have internet or connection issues, no?
Yes, absolutely.
Siguro by that time, by August 4, okay na tayo ha.
August 4.
Ano bang gusto niyong exam? Yung would you like this Morse type? You answer A if it's 1, 2, 3 are correct. B if 1 and 3, C if 2 and 4, yung mga ganon. You answer D if only 4 is correct. You answer E if all are correct. Di ba mas maganda yon?
Oh.
Sige, for module 3. Kasi ang gusto ko kasi we go by Zangfo organs and incorporate everything, no? We will also discuss the treatment already. And next week, we're going to teach you how to fill out the intake form. And on the 10th week, actually, ang galing-galing nyo na nga eh. We'll just breeze through it. Diba? So, I want you to keep all your records of your patients. Diba you're excited to align yourselves with the medical practitioners, right? O sige, konting effort pa. 2 linggo na lang for module 2. Maraming salamat po.
Yes.
And thank you po.
Thank
And
you,
ingat
Doc.
po kayo
Thank you,
dyan.
everyone.
Thank you.
Natutunan na
Good
naman
night.
ako.
Yeah, enjoy your weekend. Sige po.
Good
Say
night,
hello.
Joy.
Thank you, Doc. Thank you.
Good night,
Good night.
everyone.
Good night. Bye-bye.
Nice meeting you, Fred.
Yes, take care.